Hello guys, a very good evening to all of you, and I welcome all of you to the weekly pharmacology first session of this season. Whoever is targeting NEETPG 2023, and of course the INI set will happen. So first of all, tell me guys, how are you all? How are you guys holding up? कैसे हो आप सब? Good evening, Neha, Parth, Varun. Good evening to all of you. कैसे हो बताओ, कैसे हो, कैसे चल रही है तैयारी? हाउ आर यू प्रिपेयरिंग गाइस? हाउ आर यू गाइस होल्डिंग अप? एंड is high time since September will pass October. By towards the end of October or November, you should be able to finish the course. Right, good evening to all of you. Right, so it's high time, and see, I'll tell you one thing: if you're not able to wrap up the course by November, November is like, the threshold, it is the ceiling. You cannot go beyond November, keeping in mind that the exam might be in Jan. We don't know if the exam will be in Jan or not, right? So, see, first of all, try to understand no prep is perfect. No one's preparation is perfect. Even if I give you another 100 years to prepare, at the end of the 100 years, you would still ask to God, God, can I have 2-3 more months, right? So I have felt it. Every faculty has felt it. Every student feels that. So it cannot be perfect. So if there are some subjects which you are not able to wrap faster, you can use the revision videos and be bullish on QBank. So you have to find a way out, right? So guys, does not matter which exam you're preparing for, NEET PG, FMG, whatever exam, this session is going to help you in all those exams. And see, first of all, let us try to understand why I do these sessions, right? Now, the students who have already passed last year, they know the value of these sessions. This is not for everyone. I mean, if you are strong in pharma, if you're confident in pharma, you don't need to follow my schedule. You can make your own schedule based upon your strength. But if you are weak in pharma, and after studying pharma for some time, you finish the course, then you go back to the first topic, and you have a doubt on yourself as if these are your own notes or someone else. तो जैसे जैसे आप आगे बढ़ते हो, पीछे की दुनिया उजड़ती जाती है. अगर ऐसा होता है, then this is what is required. See, I will be regular. See, it's not about me being regular. It's more about you being regular, right? And SM, yeah, I watched Sandman, and Sandman is okay till the 4th or 5th episode. It is okay. So see, why I'm doing these sessions. See, I will try. So it's not about me, guys. It's not about me. I've told you earlier. The most important part of these sessions, the cake of pharma is not the live session. The live session is just the cherry. The cake is this one. The cake is what you do in this 1 week, right? What you do in this 1 week. So now see, week 1, September 5 to 11, you try to understand what is the motto of doing this exercise, why I'm dividing it from Monday to Sunday, and a live session we are having on Sunday. This is the least important part. The most important part is what you do from Monday to Saturday. So I told you earlier, let us say one part you will study for from 1 to 2 hours. It will depend upon person to person if you're studying for the first time or second time. So 1 hour, 1.5 hour, 2 hours, you study. Then on the second day, you'll revise it for 15 minutes. Third day, you'll overlook, re-revise for 5 minutes. Now, guys, this is the whole idea of doing these sessions. Now, students last year who have done this, they have benefited. The reason being, what it increases is called as retention. Your retention will increase. Now, this is the most important part, triplet. You'll keep on moving day after day, day after day. And at the end of the day, I'll cover everything. See, the video will be available. I'll not delete the videos. The video will be available until your NEET exam, until I do the next live session before the next, to the next season of weekly pharmacology. So guys, this is most important part. This is what you have to follow. Don't think कि 5 minutes में क्या हो जाएगा. Don't think like that. Even that 5 minutes where you are gonna overlook, right, in such a small span of time, you are able to do that because you have studied everything twice for 1 to 2 hours and 15 minutes. That is the reason why you're able to overlook. And by doing things time and again, what are we trying to do is get things into our permanent memory. Now, if I do this, when I go back at the end of the day, before the exam, you will not feel lost in the world of pharma. You'll retain a lot of things. And whatever doubts you have, I'll cover at last. Regarding to your prep, regarding to pharma, today, please ask questions only on general pharma. Please do not ask on ANS, CVS, CNS. We'll keep that for those sessions so that the session is not diluted, right? And second thing, I would like to advise you, see, what differentiates a topper from others is hard work, strategy, and little bit of smartness, right? It's not only about IQ. And you have a good IQ, it can take you only to some amount of distance, right? So IQ is never a factor. Wherever you have studied from, India, outside India, from a very small college, from private college, from government college, from AIMS, competitive exam does not spare anybody, guys. It can blast anybody. No, it does not matter where you are from. But if you strategize well, so what I'm telling here is, see, for example, this is what I said, is pharmacokinetics. Pharmacokinetics is a topic which will run into pages. So I should be able to concise the entire topic, because it's a big topic, into 1 to 2 pages. So you'll need 2 pages. So your copies, you'll need 2 pages for absorption, distribution, metabolism, excretion. And you don't need to write everything to concise. You just need to write the important facts as I've written here. So this is from one of my lectures for the revision kind of lecture. And this is where I concise the whole. So you can see the whole pharmacokinetics in 2 pages, only 2 pages. The same thing you can do with pharmacodynamics. And this is one thing that you have to prepare. You have to work hard and you have to make it yourself, and it is going to work. I try to make it for you guys, but I'm not able to do that. The reason being due to lack of time. All right, so this PDF is not there. I tried to make the PDF, but I could not make the PDF. I'll try for the next session to make the PDF, because this is in my, iPad. It is in my iPad, and I'm not able to, export it from iPad, because in Windows I can do that, but here it is a little bit difficult to do that. But anyways, guys, see. So I told you, whoever has joined late, that the main reason of this session is what you do from Monday to Saturday. That is most important. If you have time, you can come and join me, and we can revise some questions. I can clear your doubts, right? That's we can do. But the most important part is what you do from Monday to Saturday, right? If you don't have time exactly, then you can come some other day and watch the videos. I'm not gonna delete them, right? As it is, you have a lot of information. So these sessions, so guys, this will be our next schedule. I'll post that. This is the schedule for ANS, or autonomic nervous system. If you want, you can take a screenshot. But anyways, I'll be posting it in all social media as well, right? Yeah, this video will be available later, guys. This video will be available later. Now, in this part, I'll discuss some of the recently asked questions, but not exactly as they've been asked. I'll twist it, turn it, because this is how the questions are being framed nowadays. The topics are repeated, right? But the questions are rarely repeated nowadays. Topic is same, right? For example, this is from one of the MCQ that was asked. I mixed 3 to 4 MCQs, made one MCQ. Which of the following representation is incorrect? AUC, extent of absorption; Tmax, rate of absorption; ED50, efficacy; LD50, toxicity. Right. Incorrect, guys. Incorrect. See, Farmcast, I'll continue Farmcast, guys. I'll continue. The only reason is I was not having time due to offline classes. And that offline classes, they all of a sudden there is a pent up demand in offline classes. So I'll try to record some Farmcasts. Come on, guys. Come on. What is the answer? A, B, C, or D? Excellent. So most of you are with the right answer. And see, from this MCQ, what we can learn is, recently they had asked you area under the curve. It tells us about bioavailability, and bioavailability, it tells us about extent of absorption. Extent मतलब समझो कितना absorb हो रहा है, amount which is getting absorbed, extent of absorption, right? So is it 10%, 20%, 50%? So if I say 50% from 1000 milligrams, it becomes 500 milligrams. Are you getting my point? So extent मतलब कितना absorb हो रहा है, how much is getting absorbed. Tmax, it tells us about rate of absorption. Rate of absorption, so all of you guys, you know that whenever I draw a graph, and suppose this is the graph, and suppose this is the graph, and what is this called as Cmax, and this is what is called as Tmax. Here we have time, here we have plasma concentration. See, the MCQs will be repeated. If you'll just mug up that Tmax is the rate of absorption, you might not be able to solve the MCQ next time. Next time, they might not give you this Cmax, they might not give you Tmax, nothing. They'll just give you a question mark here, a question mark, plasma concentration, time, and they'll ask you what this question mark represents. Right? Again, your answer would be what? Rate of absorption. The topic is same, but the way it has been asked is different. Or how they can ask this MCQ, they'll give you 3-4 graphs. Suppose this is another graph. Suppose this is another graph. And suppose there are 3 drugs, A, B, and C, and they'll ask you, among A, B, and C, which one has a faster absorption, or which one will produce effect first, right? And that the answer would be which one? Tell me, out of A, B, and C, which drug will produce effect first? Which one, guys? A is the right answer, because see, you have to draw the perpendicular down and then have to find the answer. A, it has minimum Tmax. So remember, Tmax, it is inversely proportional to rate of absorption, ROA. Excellent, guys, excellent. All of you are excellent. So you've understood the topic. So these 2 MCQs, they have been asked recently. Now, ED50, it does not represent efficacy. This is the answer here. ED50, it represents what? Potency. So it has been asked. ED50, it represents potency. LD50, it is lethal dose 50, and it represents toxicity. That is correct. It is lethal dose, but it represents toxicity. So remember, there are 2 things. TD50 and LD50 both represent toxicity. LD50 is done in animals. I cannot do it in humans, right? TD50 is done in humans. See, ED50 and LD50. See, guys, if you don't know what is ED50 and LD50, these are simple things. ED50 or effective dose 50. ED50 is the dose that is required. It is a dose required to produce effect in 50% of patients or population, you can say. Now you can see ED50, it is the dose required to produce effect in 50% of population. Now, what is constant here? You can see what is constant. Your effect is constant. But what is changing? Dose required. More dose required, drug is less potent. Less dose required, drug is more potent. So that is the reason why ED50 is a marker of potency. Similarly, if you look at LD50, lethal dose 50, right, it is same dose required to kill 50% of animals. Dose required to kill 50% of animals. So if I need lesser dose, to kill 50% of animals, the drug is more toxic. If I need more dose, it is less toxic. Now, the significance of these two I'll be discussing in a short while as well. Right. So here, your answer is correct, guys. All of you have given the right answer. Answer is ED50, that is efficacy. Now, coming to the next question here. See, this question has been asked in different way. I'm asking in a different way. The range depicted in the graph. So it's basically this range. The range depicted in the graph signifies therapeutic index, therapeutic window, therapeutic concentration, therapeutic door. All right. Come on, guys. Come on. Faster. What is the answer? Is it therapeutic index, therapeutic window, therapeutic concentration, therapeutic door? Excellent, guys. Excellent. First of all, there is nothing like therapeutic door. Right? Therapeutic door ऐसा कुछ होता नहीं है. This is something that is invented by me to make the MCQ because I had to make the fourth option. Anyway, so this is not therapeutic index. We'll discuss what is therapeutic index in a short while. It is not therapeutic concentration because therapeutic concentration is this one. It is not the window per se. So answer is therapeutic window. Now, what is this therapeutic window? What is this therapeutic window? For example, I know, see, for example, I say lithium is a drug which has a low therapeutic index. Lithium is a drug which is a low therapeutic index. See, therapeutic index is a qualitative parameter. It tells us about the quality, about the drug, how safe the drug is. And therapeutic index, it is a measure of drug safety range, right? So it tells us about quality. Quality means what? If I say a drug has low therapeutic index, means it is safe only within a small range. If a drug has high therapeutic index, it is safe within a long range. But I don't know the range. So it is not quantitative, it is qualitative. But what tells me about that range is this, that is called as therapeutic window. For example, the same drug lithium, its MEC or minimum effective concentration is 0.6 milliequivalents per liter, but the minimum toxic concentration is 1.5 milliequivalents per liter. It is 1.5 milliequivalents per liter. All of you might know this because I see toxicity. It is called as MTC because I see toxicity beyond 1.5. So 0.6 to 1.5 is a safe range, and this is called as therapeutic window, or this is also known as therapeutic range. This is called as therapeutic window or therapeutic range. So this is a qualitative parameter. This is a qualitative parameter, right? Now tell me, as a doctor, which is more important? Is it therapeutic index or is it therapeutic window? Which is more important, guys? हाँ जी बेटे, बताओ. What is the answer? Which is more important, therapeutic index or therapeutic window? All right, most of you have gone for window as the answer. And that is the right answer. That is the right answer. Excellent, guys. I'm proud of all of you. I'm so proud of all of you that you have got the concept right. The reason being, say, therapeutic index, it just gives me an idea. It just gives me an idea that the drug is safe or unsafe within a low or high range, right? But it is therapeutic window which, as a clinician, gives me a guidance that I should dose the drug in such a way that the plasma concentration should remain within this range, and to make sure that the drug with low therapeutic index is within the therapeutic window I do something called as what? Therapeutic drug monitoring. So therapeutic drug monitoring is done, right? Therapeutic drug monitoring is done to make sure that it is within the therapeutic range. So mind it, guys, mind it. If they ask you about this graph, this is an image, they can ask you, what is it? It is therapeutic window, and all of you are correct. Now, therapeutic index, see, whenever they ask you about therapeutic index, they'll give you this graph. They'll give you this graph, and this is nothing but this is a quantal dose response curve. It is a quantal DRC or quantal dose response curve, where in animals, the therapeutic index, and humans, it is LD50 by ED50, and it is TD50 by ED50. TD50 by ED50 in humans, because LD50 I cannot determine in humans, right? So quantal DRC, and we draw these by taking the therapeutic effect and toxic effect, and then I take this 50% effect or 50% toxic effect. I draw perpendiculars. Now I've covered this in my lectures in Marrow. I've covered this, and how do you calculate? So I'm just showing you the graph. If they give you this graph, what does it represent? Your answer would be therapeutic index. If they give you this graph and then they ask you what does it represent, your answer would be therapeutic window, right? Excellent, guys. Volume of distribution of a drug does not depend on volume of distribution of a drug. So see, volume of distribution MCQs are not difficult. They are on the easier side. They're on the easier side. Obesity, age, sex, physical activity. We have discussed this. This is not a difficult one. I mean, you could solve such kind of MCQs even in your dreams. Right, so what is the answer, guys? Come on, this is an easy one, guys. See, such MCQs, you should not take more than 5 seconds. See how the competitive exams, they work. In your competitive exams, you'll have 40 to 50% questions which are on the easier side. Then 30% questions, they are moderate. And 20% questions are from Mars, about which you don't know anything, right? So those 50% questions or 40% which are on the easier side, you have to solve them soon, as fast as possible, so that you can save time. You can save time which you can reinvest in those MCQs which are difficult to solve. Excellent, guys, excellent. All of you are correct here. Physical activity. See, volume of distribution of a drug, it depends upon obesity, because see, drugs, they are distributed into adipose tissue, fat cells mostly. So lipid solubility is important. Obesity is important. Age is important. With age, the fat content, water content changes. Sex is important because females, they are more fat as compared to males. So anyways, our aim was, so the answer here, the answer is D. Answer is D, that is physical activity has nothing to do with volume of distribution. All right. Now you can look at this question. This was recently asked in INI set. I have changed the MCQ. I told you. I'll cover in these sessions, I'll cover the recently asked NEETPG INI set questions, but I will change them. I'll change them, right? All right, 107 is asking physical activity affects obesity. See, physical activity, I mean to say, when you are taking the drug. So for example, you are taking a drug for 7 to 10 days. 7-10 days physical activity is not going to change much, right? Now, this is an MCQ which was asked. A patient on digoxin, potassium chloride, clarithromycin, atenolol, triamterene developed atrial fibrillation with controlled ventricular rate. Serum digoxin levels were raised, which the following is responsible for the same. Now see, this question has been asked. You must have seen this question with many recall videos, right? But the problem arises, see, where do you find a guy who gets a rank and who does not get a rank? Right? What separates people, rankers and non-rankers, is if a topic has been asked, the rankers, they know as to why the answer, that question which was asked in your exam, that asked you, which of the following drug has caused this particular effect? These are 4 options: KCl, clarithromycin, atenolol, triamterene. And in that MCQ, your answer was clarithromycin. So just try to understand why we do previous year's question, not to mug up the answers, but to know the topics and understand the topic. This topic is about PGP, P-glycoprotein pump, And guys, I've covered this. I've covered this in your lecture. It's not that I've not taught you. I've covered P glycoprotein pump, which is usually not covered even in textbooks, but I do cover because I know they do ask. Jipmer loves to ask about P glycoprotein pump. That is the reason why you had MCQ in INI set. And P glycoprotein pump, see, substrate. And I've told you this in your exam. I don't tell you many substrate. I tell you only one substrate, that is digoxin. Digoxin is a substrate for P glycoprotein pump. Then remember, I told you about inhibitors of PGP, and I've given you a mnemonic called as vaccine. And E is for erythromycin and clarithromycin, macrolide. So usually remember the pharmacokinetic properties, enzyme inhibition, PGP inhibition, QT prolongation, all of these, they are seen with all the macrolides. They're more with erythro and clarithromycin. So what clarithromycin does, clarithromycin is a PGP inhibitor. So clarithromycin, it inhibits digoxin, it inhibits drug efflux. And because of that, clarithromycin increases bioavailability of digoxin. Now remember, a ranker, when this question is asked, a ranker knows that MCQs will be asked on this topic. So this is the basic information you should be clear in your head. The next time they will ask you on these, see the MCQ, the topic will be same. The way they'll ask it will change. So what is the answer here? See, clarithromycin causes enzyme inhibition. But here the reason is not enzyme inhibition. So clarithromycin is an enzyme inhibitor. But the reason why here toxicity is seen is because of P glycoprotein inhibition. Right? And remember, every enzyme inhibitor cannot inhibit metabolism of every drug. The enzyme for metabolism, right, and the enzyme which is being inhibited, they must be same. They must be same. See, potassium does not increase digoxin toxicity. Potassium, rather, I've taught this in the lecture. Potassium is rather used in digoxin toxicity. Do you remember? I've told you potassium is used in digoxin toxicity if the arrhythmia are benign, like bigeminy, trigeminy, or ventricular premature beats, which are non-malignant arrhythmia. But if it is ventricular tachycardia or fibrillation, then I don't use potassium. Right. So anyway, see, you might do this question wrong, but the reason is you have to look at the explanation. And I don't know, I mean, if you have gone through my videos or lectures, I've covered this. I've covered this exactly. I've told you that this drug toxicity can be seen. Next time, how they can ask the MCQ. See, the topic is same. The topic is same. They'll ask you that there is a patient was given, a patient is on a drug for TB and it decreases digoxin. Now, answer would be rifampicin. And remember, the reason is not enzyme induction. The reason is P glycoprotein inducer. The enzyme inducers are P glycoprotein inducer like rifampicin, carbamazepine. These are enzyme inducer, right? So your answer would be rifampicin. So see, this is one topic which you should know. See, the MCQs might be asked, might not be asked, but make it a point whenever you go through a previous year question and you look at the topic, if you don't know about the topic, go to the videos, master the topic, right? A drug follows zero order, is given 300 milligrams and has a half-life of 2 hours. If the dose is increased by 900 milligrams, what would be the half-life? It's a very simple question if you know mathematics. But I know we doctors are not that good at mathematics, right? Is my voice okay, guys? Or is my voice cracking? Is my voice okay? What's the answer? A, B, C, or D? Okay, thank you guys. Thank you for telling me. Thank you, Amulya. This is my beach shirt. I'm on a beach mode now because I finished my classes. I'm going to say offline classes. So I'm serving you guys now through online lectures, right? All right. All of you have lost the battle, and you have not lost the battle to pharma. You have lost the battle to to English language. You have lost the battle to English language. You have lost the battle to one word, and that word is by. Here I played with the word English language. You have lost this battle to this one word by. इस बाय की वजह से आपको हो गया बाय बाय, राइट? आपका आंसर गलत हो गया इज बिकॉज ऑफ दिस वर्ड बाय. Now at least now tell me what is the answer. देखो ऐसा ही होता है. This is how it happens. You go to the exam and you solve the question, you come back and you do the recalls and you're getting 70%, but in exam it comes down to 45% or 50%. Is because during the exam, right, you miss on certain English language. कई बार English language में गड़बड़ हो जाती है. And when you come back and when you do the recall, you begin to fight with each other because you change the question based upon your answer you have marked. That is called as human defense, right? That is how even we used to do and you guys also used to do. So answer is D. All of you know that answer is D. Now see, if the dose is increased by 900 milligrams, so now dose becomes how much? Dose becomes 1200 milligrams. Dose becomes 1200 milligrams. And if the dose is 300 milligrams, half-life is 2 hours. 1200 milligrams 4 times 2 into 4 is equal to 8 hours. So answer is D. Answer is D. Right, answer is D, that is 2 into 4, 8 hours. So guys, all of you know in zero order, as half-life increases, right? I mean, so as dose increases, half-life increases and clearance decreases. In first order, half-life and clearance both are constant. All right, guys. So you understood, right? You knew the answer. It's not that you didn't know the answer. You knew the answer. You are perfectly prepared. The only reason why you made the answer a wrong attempt is because you hurried. You hurried with the answer. So make it a point, guys. Never hurry with the answer. कई बार क्वेश्चन देख के लगता है मेरे को तो आंसर आता है और दिल में क्या, दिल डांस करने लगता है, आंसर आता है मेरे को, मैं जाके मार्क कर दूं. अपने आप को कंट्रोल करना. Learn to control yourself even if the question is easy. Make sure that you've read the question twice, right? Yeah, if the drug follows first order, it would be same. Now look at the next question, guys. This is the question of INI said June 2021. I have given this question as it is. What would happen to the elimination half-life and plasma concentration of a drug that follows first order kinetics if the dose is doubled? T half doubles, plasma concentration doubles. T half same, plasma concentration doubles. T half and plasma concentration will remain the same. T half and plasma concentration doubles. Come on, guys, what is the answer? Now see, this is a question which was recently asked. Recent, June 2021. 2021 is not that far. You don't have any excuse. I'm not asking you from 2011, right? 2021. So you don't have any excuse. And it's the same question. I haven't even modified it. Come on, guys. What is the answer? Come on. See, guys, many of you have given the answer as C, and it pains me. It pains me to tell you that this is not the right answer. Plasma concentration will remain. So T half is same. This is correct, but plasma concentration will not remain same. What is same? What is same in first order? All right. Let us see what do we know. What do we know about zero and first order? What do we know about zero order? In zero order, we know as dose increases, half-life increases, clearance decreases, right? In first order, you have what? You have a constant half-life and constant clearance. So what is constant? Clearance is constant. Is it clearance in the option? Many of you have given the C answer as right. That is wrong. That is wrong, right? So what is the answer here? What is the answer, guys? T half same, plasma concentration doubles. What is the answer? Come on, come on, come on. Now at least now give me the right answer, guys. Three options are left. A, B, D. What is the right answer? Come on. What is the right answer? A, B, or D? Come on, come on, come on. Is it A, B, or D? Excellent, excellent. All of you guys, you have got the right answer now. And B. And don't do like that. Please practice the PYQs, previous year question, right? So what I want you guys to learn here, that in zero order and first order, as dose increases. Excellent, guys, excellent. Now answer me something else. As dose increases in zero order and first order, what happens to plasma concentration in both? Come on, comment and let me know. What happens to plasma concentration in zero order? What happens to plasma concentration in first order? What happens to plasma concentration in zero order? And what happens to plasma concentration in first order? Come on. Come on, come on, come on. What happens? What happens? Right. As dose increases, okay, come on, comment. Keep on commenting. Whatever be the answer. You might be wrong at the end of the day, but that is not a problem. Comment the wrong answer so that it gets registered in your brain when you get the right answer. All right. Now let's look at the screen. Now get this. Plasma concentration increases. Plasma concentration increases in both in zero order and first order. Plasma concentration is gonna increase in both. Then what is the difference? Plasma concentration increases in both. It increases in both. It increases in both. But there is a difference in increase. Here the increase is disproportionate. Here the increase is proportionate. Now what does it mean? It means what? For example, just a simple example. Suppose the dose increases by 2 times. Then plasma concentration also increases by 2 times. This is first order. If the dose increases by 2 times, plasma concentration increases by 2 times. This is first order. If the dose increases by 2 times, plasma concentration increases by 4 times. This is zero order. Why? The reason being, in zero order, what is constant? A constant amount is being eliminated per hour. Amount is constant. And that is the reason when you increase the dose, a lot of drug, it keeps on remaining in my body, and that would increase the plasma concentration disproportionately. Right, guys? Now see, this is the part. This is what they are going to repeat in the next exams. This is what they're going to repeat. And this is what it should be clear. You should be clear in your head about this. So here you can see the answer is obviously B, right? If the dose is doubled, you can see T half remains same, but plasma concentration doubles. All right, this is related to dosing of drug. I made this MCQ specifically for you guys to cover a different type of topic. It might be asked in INI set. Different graphs for modified oral drug delivery system are given. Which of the following graph is a sustained release tablets? Which of the following graph is for sustained release tablets? A, B, C, or D? A, B, C, or D? Come on, comment. All right. Many of you have gone for. See, whatever doubt you have, you can ask me at last. Whatever doubt you have. At last, we'll discuss your doubts at last, towards the end. See, guys, let me tell you what is this A. Graph A, it is called as immediate release. So you give a tablet, it is immediately released, tablet or capsule, right? D. Can you tell me what is D? Okay, make a guess. What is D? I'll get to the answer. But gradually. Tell me what is D. Tell me what is graph D. What is D, guys? Anyone? Any idea what is D? Maurice Columbus, I'm not going to delete the video, so you can later come back and you can watch it. Very good. Who has given the answer? Aditi Ghosh. Aditi Ghosh, 3 cheers to Aditi Ghosh, Ayush Savalkar. These two guys have given the right answer. These are delayed release. These are delayed release tablets. D is delayed release, A is immediate release. Now, what is C? If you look at C, what is C? See, guys, C is called as zero order controlled release. C is called as zero order controlled release. The reason being, because of zero order controlled release, you can see the plasma concentration is constant. So it's neither A nor D nor C. So what I get here is this one, B. B, these are sustained release. So see what happens. So here answer is, guys, graph B is the right answer. Now, try to understand, try to get this point. Many of you get upset when you're not able to solve questions in the Q bank. Right? So don't get upset. If you're able to solve all the questions, then what is the credibility of the person who is making the questions? You have to think about the adrenaline of that person also, isn't it? So we cannot solve all the questions. If you're able to solve 60 to 70% questions, that is well, that is good. The real day exam is much different than you think. So see here, you can see why do we make sustained release or zero order controlled release tablets? The reason of making sustained release or zero order controlled release tablets, these two are made for drugs with short half-life, so that I can give minimal dosing, right? Because short half-life drugs will have more dosing. Second is, you can see the plasma concentration in immediate release, it achieves a peak. So immediate release, they have more risk of toxicity. Whereas these drugs, these drugs, they have lesser risk of toxicity. Whereas why do we make delayed release? Why do we make delayed release tablets? A tablet which will be delayed after I take the tablet. For example, one reason could be if a tablet can be affected by food, or if a tablet or drug can be affected by acid, can break it down. And for that, I also use another method to protect from acid, entry coated. See, entry coating is done to protect from hydrochloric acid mostly, right? Uh, FMG PYQ. See, I'll try to do a session on FMG PYQ as well. All right. So, see, this is a topic that usually I do not teach in my classes, but in these live sessions, I'll give you something extra as well, right? So that you can just go through them once in case they ask you. These are about different release. All right, guys. So this is a question of INICT May 2022. I have not changed. I have not changed the question at all because it was a doubt of a lot of students. I've included this, and it is indeed a smart question. All right, guys. So see response of A, B, C, D, four drugs, and which one is correct? Is it A, B, C, or D? Paresh Kapoor, sir, where can we buy your Pharmally video? See, Pharmally, I have closed it for the time being. I'll let you know later when I reopen it because some changes are going on. Come on, guys, come on. What is the answer here? What is the answer here? See, all cannot be wrong. It is ionized May, and this is a question which is designed by AIMS. They're notorious. AIMS guys are notorious for making such questions. देखो एम्स वालों को ना मजा लेने में अच्छा आता है, हमको मजा आता है, प्रोफेसर्स को मजा आता है, आप लोग के मजा लेते हो. दैट इज द रीजन व्हाई दे मेक सच क्वेश्चंस. हर किसी को अपना मजा चाहिए, है कि नहीं? तो प्रोफेसर्स के जीवन में बचा क्या है बताओ? मजा ही तो बचा. किसके मजे लेंगे? तुम्हारे मजे लेंगे. राइट. See, here there is one option that is correct. All right, now if you look at this, option A is full agonist. Option A is full agonist. Option B is partial agonist. Option C is antagonist. Option D is inverse agonist. Option D is inverse agonist. See, this is not my question, guys. I have not made this question. This is not my question, right? So inverse agonist. But still we have an answer. Still we have an answer here. The reason being, remember, see, let me tell you what is the basic concept. See, whenever I say what is an antagonist, what is an antagonist? Suppose there is a receptor. There is a receptor, and suppose adrenaline binds to the receptor. Suppose this is beta 1 receptor, and adrenaline increases heart rate by, let us say, 100 beats per minute. Now listen to this, guys. I'm explaining you an important concept here. Adrenaline will bind and increase heart rate by 100 beats per minute, right? Now if I give an antagonist, if I give a beta blocker, that is an antagonist, and this beta blocker, let us suppose it binds to, let us say, 50% receptors. 50% receptors, and because of which beta blockers, antagonists, they have no effect. They have no effect. So now only 50% receptors will produce effect, and that heart rate would be 50 beats per minute. So whenever I give a beta blocker, try to understand this. 50% receptors, there is no effect. 50% receptor, no effect, because antagonists, they do not have any effect. So now only 50% of receptors are producing effect, because of which ligand, that is adrenaline. This is what happens in antagonists. Now what happens in inverse agonists? What happens in inverse agonists? Try to understand this. Same example, adrenaline increasing heart rate by 100 beats per minute. Now I'm not giving a beta blocker that is antagonist. Let us say, for example, a beta blocker that is inverse agonist. A beta blocker that is inverse agonist. So what is a beta blocker that is inverse agonist? It will produce opposite effect. Let us say it takes away 50% of receptors, and 50% of receptors which it has taken away, it is decreasing the heart rate by 10 beats per minute. Decreasing the heart rate, right? It is decreasing the heart rate by 10 beats per minute. But also those 50% of receptors which have been taken away by beta blocker, adrenaline cannot bind to these 50% of receptors. I get my point. And that is the reason why there will again be a decrease in heart rate by 50 beats per minute. So in total, the decrease would be 60 beats per minute. So the heart rate, which is 100, it becomes 40 beats per minute. So an inverse agonist produces effect not only because it produces opposite effect, but also because an inverse agonist is occupying the receptor a full agonist cannot bind. In other words, an inverse agonist is also an antagonist. Now, if you have understood what is the meaning of antagonist, what is the meaning of antagonism? When a drug goes, sits on the receptor, does not allow anyone else to bind to the receptor, this is antagonism. An inverse agonist goes, sits on the receptor, does not allow anyone else to bind, that is antagonism. But it does not sit idle, it also itself decreases the effect. So an inverse agonist, see, inverse agonist cannot bind both in antagonist and inverse agonist. Right? Adrenaline cannot bind both in antagonist and inverse agonist. Right? So this is the reason why an inverse agonist, see, many a times they write the following drug is an inverse agonist slash antagonist. Inverse agonist slash antagonist. Now, can you tell me what is the answer, guys? Now, can you tell me what is the answer? Is it A, B, C, or D? So it's not that there is not answer or the options are wrong. The options are never wrong, right? Now, what is the answer? Now you are there. Now you're there. Now you guys are giving me the right answer. So the answer, now the answer is option A. Option A is the right answer. Excellent, guys. Proud of you all. All right. Coming to the next question. It's not a difficult one. So I think you should be able to cruise through it. Normal healthy volunteers are participants in phase 1, phase 2 and 3, phase 4, phase 1 and 0. अच्छा, होगा कैडसंग में होगा, मे बी पॉसिबल, आई हैव नॉट सीन. ABCD, phase 1, phase 2 and 3, phase 4, phase 1 and 0. Come on, guys. What is the answer? All right. Many of you have given answer as A, but let me tell you that you might have done in hurry. Let me tell you another point. Whenever you see MCQs, normal healthy volunteers are participants in, you will jump with joy. I know the answer. And you look at the option A, oh, there is the answer. Option A is the answer. And you'll not even go till option D. Don't do that. This is not the right answer here. Here the better answer is phase 1 and 0. Phase 1 and 0. See, normal volunteers are taken. Normal volunteers are taken in both phase 1 and 0. And phase 0, it is called as microdosing. Phase 0 is not mandatory. Right? Phase 0 is mandatory, not mandatory. But phase 1 and 0, here we use normal healthy volunteers. Right? So it's a twister one, guys. So there is a reason why I make such MCQs for you guys, so that I can remind you time and again that many times you know the topic, but you end up marking a wrong answer because either you are impatient or you are too much excited about it, or you don't have time to read the question carefully. You misjudge the English language, or you just don't read all the options. A drug is banned in case of unfavorable pharmacovigilance report by Indian Pharmacopoeia Commission, Health Ministry, CDSCO, FDO. I've taught you this topic of pharmacovigilance in well detail. Detail में पढ़ा है मैंने आपको pharmacovigilance. So you guys should be able to give me the right answer here. Come on. A drug is banned in case of unfavorable pharmacovigilance report. What is the answer here? देखो, मैंने जाल बिछाया था और जाल में सारी की सारी मछलियां फंस गई. जाल में सारी की सारी मछलियां फंस गई, तो आज हम माछ भात खाएंगे. All right. CDSCO bans a drug. We know that. CDSCO bans a drug. We know about that. But again, you lost to English language. Unfavorable report by. So look at the English language. Look at the English language. A drug is banned in case of unfavorable pharmacovigilance report by. भाई फार्माकोविजिलेंस की रिपोर्ट बनाता कौन है कि भाई ये जो ड्रग है ये टॉक्सिक है, इंडिया में मचा रहा है. Who makes a report that this drug is toxic, it is causing havoc in the country and we need to ban it? Who makes the report? Does CDSCO makes the report? Who makes the report? Who makes the report? Who makes the report, guys? Who makes the report? CDSCO, it bans the drug. But remember, I told you this exactly. The conclusive ADR report, it is made by Pharmacopoeia Commission, and this conclusive ADR report, it is forwarded to CDSCO. Now try to understand. FDA आंसर नहीं होगा भाई. आप हिंदुस्तान में हो, आप यूएस में नहीं हो. आप यूएसएमएल दे करके वहां जाओगे तब FDA आंसर होगा. In India, the answer would be different. FDA is the answer in US. Now here, your answer is option A, Indian Pharmacopoeia Commission. क्वेश्चन क्या पूछ रहा है? ड्रग इज बैंड इन केस ऑफ अनफेवरेबल फार्माकोविजिलेंस रिपोर्ट बाय. रिपोर्ट कौन बनाता है भाई? रिपोर्ट किसने बनाया? दैट दिस कंक्लूसिव एडीआर रिपोर्ट इज मेड बाय होम? इंडियन फार्माकोपिया कमीशन. हेल्थ मिनिस्ट्री नहीं बैन करती. हेल्थ मिनिस्ट्री वैसे भी कोई काम नहीं करती, आपको पता है. इंडिया में कहां बैन करेगी? So answer is A, guys. Answer is A. So see, try to understand again. This is a topic you guys must have revised, studied, but again, you lose uh, a question. You'll do a question wrong just because you did not analyze the question. तो आपको क्वेश्चन देखो एग्जाम में प्रेशर बहुत ज्यादा होगा. There will be a lot of pressure on you guys in exam, but you have to learn to analyze the question before giving an answer. Thomas Shelby, what if I'm watching this from USA? Thomas भाई, अमेरिका भी अपन इतने बड़े फैकल्टी बने नहीं कि अमेरिका वालों को पढ़ाए, ठीक है. So I don't teach peoples from USA. So if you are from USA, you can go for FDA or something else. All right. So Thomas भाई, I this class is for Indian PG. मैं Indian PG को पढ़ा लूँ वही बहुत है, right? Love you guys, love you. All right. So you understood, you got the hang of it. You got the hang of it. What is the meaning of this? All right. Morphine is an example of orphan drug, prototype drug, non-essential drug, Me Too drug. Okay, Thomas is from Tamil Nadu. Okay, Thomas. See, guys, I'll speak English. I'll speak Hindi as well. Sometimes because. So what is the answer? Orphan drug, prototype drug, non-essential drug, Me Too drug. तो देखो ड्रग में भी Me Too है. Right. Prototype drug, P for prototype, P for प्रधान. घर का प्रधान कौन है? In English language, pradhan means the head of the family. The head of the family. Pradhan means the head of the family. So who is the morphine is an example of prototype drug. Prototype drug, and prototype drug means the head of the family. मुखिया, या कह लो कि ताऊ कौन है? ताऊ तो ओपियोइड वाले फैमिली का ताऊ है मॉर्फिन, राइट. बाकी भतीजे ये वो भाई बंधु है कोडेइन, नॉस्कापाइन, ये वो जो है ना. सो प्रधान, प्रोटोटाइप ड्रग. Yeah, it's mukhia, it's pradhan of all drug. All right, what is an orphan drug? All of you know orphan drug. It is a drug used for treatment of rare disease. Rare disease. Non-essential drug. There is no term as such. ऐसा कोई term है नहीं. ये मैंने बनाया है. ये मेरी कलाकृति है. Non-essential drug. Me Too drugs. What is a Me Too drug? What is a Me Too drug, guys? पपुआ नेक्स्ट एपिसोड बहुत जल्द आने वाला है. Me Too drug. So what is a Me Too drug? See, for example, there was omeprazole. There was a drug called as no. See, what is Me Too drug? There is a drug called as omeprazole. Then company made S omeprazole, stating that it is longer acting. Now see, it does not matter you give omeprazole or S omeprazole, because it is longer acting, the patient will have more effect. There is nothing like that, because once your proton pumps are inhibited, see, these are what? PPIs are irreversible blockers. So once they irreversibly block the PPIs, the effect is same. There is not much difference. So it means what? When a company makes drugs like S-omeprazole or levocetirizine, then this is an unnecessary invention. Cetirizine, omeprazole, they're as good as levocetirizine or esomeprazole. So the company wasted time, money, resource in doing unnecessary things. They could have invested it to make something else, something better. So these drugs, they say, esomeprazole, levocetirizine, they say, we are also there. हम भी हैं, हमें भी ले लो. Me too drugs. Me too. I too want to be in the race. These are called as me too drugs. Right? तो जब दवाई की कंपनी एसओमेप्राजोल या लेवोसेट्रिजिन जैसे ड्रग बनाते हैं, तो वो सिर्फ नया ड्रग नहीं बनाते, वो पेशेंट को भी बनाते हैं. राइट? यू अंडरस्टैंड? दैट इज द रीजन व्हाई these drugs with unnecessary invention, they are called as me too drugs. Now tell me, what is an orphan receptor? Me too drug is not equal to spurious drug, guys. Me too drug is not spurious drug. Very good. An orphan receptor, it is a receptor without, say, it is not no ligand. Two options: receptor with no ligand, unknown ligand. Two options. What is the better answer? A or B? Orphan receptor, receptor with no ligand or unknown ligand. What is the answer? Then answer would be unknown ligand. No ligand would be wrong answer. No ligand. Right, excellent. Teratogenicity is which type of ADR? Teratogenicity is which type of adverse drug reaction? Excellent, guys. Unknown is the right answer. All of you know. I'm really proud of you guys. आप सब अच्छे से पढ़ करके आए हो. Right? So you have elevated my mood as well. Thank you for that. Teratogenicity is which type of adverse drug reaction? Type A, type C, type D, type X. Come on. Levocetirizine less sedative, बकवास है. Levocetirizine is as sedative. All right. Now again, guys, you guys got confused here. और देखो फिर से आप जाल में फंस गए. आज पता नहीं कितनी मछलियां पकड़ ली है मैंने. सब फंस गए जाल में. There are two things. ADR type and drug category, and there is drug schedule and schedule. Right? ADR, here the answer is type D. ADR D means delayed. Delayed ADR means I gave the drug in first trimester. I see the teratogenicity after the baby is born. That is in the postpartum. That is after third trimester. Drug category D and X. These are teratogenic. D and X are teratogenic. D can be used, like valproate can be used if the benefit is more than risk. X is absolutely contraindicated, like thalidomide can never be given. Drug schedule, there is also one called as X. It is for narcotropic drugs. Now this is where you can get confused. Right? So ADR, like teratogenicity is type. So these are three things. Don't get confused. There are D and X. There is another X. ADR type, drug category in pregnancy, drug schedule. These are three different things. Don't get confused, right? For which of the following drug red color RX label is mandatory? RX label: opioids, antibiotics, anti-cancer drugs, laxatives. Yeah, Bharti, sometimes whenever I get time, I do workout. Golden stethoscope. I'll come to spurious and all. Don't worry. I'll cover everything. RX in red. Schedule H1. Morris Columbus. Very good. Which is schedule H1. ये सारे के सारे आंसर सी क्यों कर रहे हो भाई? व्हाई आर यू आंसरिंग ऑप्शन सी? एंटी कैंसर देख कर डर लगता है इसलिए रेड कलर. रिमेंबर, there is a schedule called as schedule H, and here we write RX in black. Schedule H, we write RX in black, and these are drugs that are given only on prescription. These are called as schedule H drugs. For antibiotics, a schedule was made H1 in 2013 and where it was written RX in red. और ये क्यों किया गया? Why it was done? To prevent abuse, misuse of antibiotics, to prevent resistance. To prevent resistance. So RX in red color. RX in red color. और गवर्नमेंट हैज डन दिस. देखो सरकार ने क्यों किया ये? सरकार को लगा कि चलो भैया हम लाल कलर में एंटीबायोटिक्स में RX लिख देते हैं ताकि लोग डर जाएंगे और एंटीबायोटिक्स नहीं खाएंगे. लेकिन हम डरने वालों में से हैं क्या? नहीं, हमें खाना है, हम खाएंगे, राइट? सो गवर्नमेंट डज अ लॉट ऑफ थिंग्स टू कंट्रोल. सो द रेड कलर वुड बी अ रेड फ्लैग, dangerous, but nobody is worried about these things. So antibiotics. Ammonium chloride is used for treatment of toxicity due to. It's not working. It's not going to work in a country like India. I mean, see, some things have to be taught in school. You cannot see, if you want to change behavior, change the behavior of a nation, you cannot change the behavior in the adulthood. You have to start bringing that change in the school itself, right? Excellent guys. Here amphetamine. See, antidote for ammonium chloride is amphetamine. Now remember, I've told you earlier, you should have 8 to 10 pages for drug of choice. All drug of choice should be written separately, and you should have 1 page for antidote of choice. You should have 1 page for antidote of choice. Now remember, in the last 7 days before the exam, you have to revise your 19 subjects once, but you cannot revise everything in 19 subjects. So in pharma, you have to revise just DOC and antidote of choice in the last 7 days before exam. Similarly, you have to find out in biochemistry the rate limiting enzymes, the number of ATPs which are produced, which enzyme deficiency causes which disease. In microbiology, the media, the appearances, etc. So you have to find out some things. पाक वर्सेस श्रीलंका स्टार्ट होने वाला है, मेरे को भी देखना है भाई. देखो ऐसा इंडिया नहीं खेल रहा तो क्या हुआ? देखो मैं मैच तभी देखता हूं जब 2 कंट्री खेल रही हो, या तो इंडिया खेल रहा हो या पाकिस्तान खेल रहा हो. इंडिया खेल रहा हो, इंडिया को सपोर्ट करो. पाकिस्तान खेल रहा तो दूसरे वाले को सपोर्ट करो. है कि नहीं? फीलिंग वही आती है. फीलिंग, हमें एड्रेनलिन से मतलब है. Teratogenic drugs are in which schedule? Teratogenic drugs are in which schedule? D and X. So guys, D and X, I've already told you this. Now it's an easier one. D and X are the right answer. A brand markets paracetamol 400 milligrams, but it is only 200 milligrams. The drug will be called as. Now this has been repeated See, paracetamol 400 milligrams, but it is only 200 milligrams. It is a spurious drug. It is not a misbranded drug. I don't know why are you giving the answer as D. Now remember, spurious drug, it actually means duplicate. It means it should not be able to produce adequate effect. So when the dose is lesser, that also goes into spurious drug. It's a spurious drug. What is a misbranded drug? Uh, Misbranded drug when there is a wrong label. If the label is wrong. For example, you know that there is a label. There is a label on every tablet, and a lot of things are written on that label, like the temperature with which I have to store the drug. I have to maintain the temperature. I have to write schedule H drug. I have to write all the constituents, milligrams, etc. If there is something wrong in the label, then it is called as, if there is something wrong in the label, it is called as misbranded. So misbranded is different. There is nothing called as unethical. Adulterated drug means something unwanted in drug. For example, the drug factory was manufacturing paracetamol tablets. Before that, they were manufacturing iron tablets in the same machine. Now they washed it, but because of improper washing, in the paracetamol tablet, there is some amount of iron as well. If they ask you like this, what is this? Your answer would be adulterated drug. So I just now explained what is adulterated or how adulterated can be made, right? A chronic alcoholic is at higher risk of hepatotoxicity due to paracetamol. This is mainly due to downregulation of CYP2C19, downregulation of CYP2D6, upregulation of CYP1A1, upregulation of CYP2E1. Now, similar MCQ was asked regarding clopidogrel recently. I've just changed that MCQ. Now, this might be a difficult one for you guys. So just try to attempt one. Which one do you think is the right answer? A, B, C, or D? Excellent, guys. Most of you are correct here. D is the right answer. See, CYP2E1, it also metabolizes ethanol. It also metabolizes ethanol. And it also metabolizes paracetamol. Right. So chronic consumption, if I'm consuming alcohol every day, there would be an increased amount of CYP2E1. So CYP2E1 will increase. CYP2E1 will increase with ethanol, and that would increase paracetamol metabolism, increase production of NAPQI, and this would increase the risk of hepatotoxicity. See, paracetamol is also metabolized by CYP1A2. 2, it is not 1. It is not CYP1A1. It is CYP1A2. But 1A2 is not the reason of hepatotoxicity, because you see, the mechanism lies here. Ethanol being metabolized by CYP2E1, or जब आप रोज every day when you consume alcohol, your liver understands this person is not gonna stop. I have to do something. Let me increase the number of enzymes. And then when I take paracetamol for that headache, it would cause hepatotoxicity. Right? You understand the reason here, guys? All right, guys. We are done. We are done with today's session, and why C is not the answer, I've told you. If you have any doubts, you can ask me, guys. Otherwise, let's go and watch the match. I don't think you guys will have any doubts today because of the match, I guess, isn't it? Bioavailability affects volume of distribution. See, bioavailability does not affect volume of distribution. This is wrong. I don't know who told you this. Clearance and zero order, first order, how they are related. See, Shivendu, Purushottam, you have not understood clearance. The reason being, you are confusing clearance with rate of drug elimination. First of all, rate of drug elimination is not clearance, right? So clearance is what? It is the amount of plasma that is cleared of the drug per hour. So prati ghante, per hour, how much plasma is getting cleared of the drug. Now just imagine if I have more drug in plasma, that clearance will be delayed. There is a reason why as dose increases, clearance decreases in zero order. But because in case of first order, right, the proportional or percentage of drug eliminated is constant, even if the drug plasma concentration increases, the clearance increases. I mean, the amount eliminated increases, and there is a reason why clearance is constant. So next session would be next Sunday. Thomas Shelby, yes. There is some bit of personal experience as well. See, topic for next session, guys, I've already told you in the beginning. And why does plasma concentration becomes 4 times in zero order if the drug dose is doubled? The reason being the amount of drug eliminated is constant, like 20 milligrams per hour is removed. So if I give a 100 milligram tablet, how much is removed? 20 milligrams per hour. If I give 200, how much is removed? 20 milligrams per hour. If I give 400, how much is removed? 20 milligrams per hour. Are you getting my point? So when removed is constant, if I keep on increasing the tablet, the amount of drug in the body will increase, and that will increase, many-fold. Nagesh, drug acting upon cytoplasm and nuclear receptor. See, first of all, there is nothing called as a cytoplasmic receptor. Receptors are all nuclear. Their location can be in nucleus or cytoplasm. So whenever they ask you cytoplasmic receptor, they actually mean is which receptor is located in cytoplasm. And whatever I've given you in my lecture, please stick to that, because I've yesterday posted a clarification on vitamin D as well. Vitamin D is in cytoplasm. Progesterone receptor is in nucleus. I posted the reference as well. See, I don't know Pakistan is gonna win or Sri Lanka, but I'm gonna pray for Sri Lanka. And as it is, see, I have a habit that when I it's not India, then I usually end up supporting the underdogs. Nikita Roy, so how to increase the speed of studying? Nikita, the most important thing is to give yourself daily goals and then hourly goals. You should have 1 hour, and that goal should be practical. Don't give yourself like 1 hour for CVS. No, you can give 1 hour for antiarrhythmic drugs or CHF. So give yourself hourly goals, and upon that, you will see that your performance will drastically, significantly improve. Next class is on Sunday. Shravan, expected number of questions in G Pharma. You can never say. The question can be 1, 2, 3, 0. Nobody knows. See, I'll post the schedule for tomorrow. Okay. Yeah, paracetamol is metabolized by COIP2E1 and 1A2 both. All right, guys, thanks a lot. Let's go and watch the match. And you guys were really a good sport today. You answered most of the questions correct. The only thing is you need to train yourself to solve questions. While solving questions, pay importance to English language, pay importance to all the words in the question, and pay importance to all the options in the question. Rest, everything was great, guys. And even I'm looking forward to the next session. And autonomic nervous system, I'll post the schedule today, and the schedule is also in the beginning of this session. I'm not going to delete this video until the next until the next season of live session, like weekly pharmacology, which will happen after the NEET. So until your NEET exam, I'm not gonna delete these session. Anyways, so guys, take care. Bye bye. Lots of love and blessings, and see you on the other side. And if you have any doubts, you know my Insta handle. It is Doc Pharmaniac. If you have any doubts, you can always anytime you can message me, and I'll reply.